from iHeartRadio. This is Medical Monday, presented by St. Dominic's. This is Randy Bell, and I'm here with Jackie Murray, a cancer navigator at St. Dominic's. October is Breast Cancer Awareness Month, and we'll be talking about that with Jackie. As your title suggests, your job is to help guide patients through the treatment process once they've been diagnosed.
That is correct. I'm a registered nurse navigator here at St. Dominic's, and we have a small team of navigators, and we are part of that service line and that group of folks that care for any cancer patient, and especially in regards to this month being October, we really want to shine the light on breast health awareness. And I'm available to anybody throughout the spectrum of their care, for example. So from the beginning, if you're just somebody who's interested in getting screening or how do you access that, and that, kind of circles back to providers, your medical home, your doctor, your insurance, like how you get that started so that you can get those mammograms, which are so important. The navigation office is there to help you on the front end, and then throughout the care, if you have to come back in for any additional screenings, and then on through diagnosis, we are that safety net to help catch anything that might fall through the cracks.
Breast cancer is the most common cancer among women in the United States.
Most definitely, and all the cancer screenings are important, so I have to say a point about that in terms of sort of equal importance. Skin cancer, of course, screenings and are important, as well as we talk about lung cancers. We have low-dose CT screenings and lung cancers as well in our colonoscopies, and of course, we think of breast. We also think of female health and cervical and pap smears for gynecological health and cancer screenings.
And when we talk about screenings, it's all about early detection, because if someone does have cancer, finding out early increases the chances of a good outcome.
Early detection is everything in all of our healthcare needs, really. The faster that we can identify a need and move on care, the better the outcome. So we always want to put that, in the forefront of our mind. I'm well aware, and I share that experience. I don't want to go to the doctor. Nobody wants to go in. We want to wait a few days, months, whatever, see if it might go away. But we always have to keep in mind, we talk about prognostic indicators and outcomes, and those are always better if we can catch things early.
Do you sometimes have patients, though, who come in who suspect they have a problem, but they just have put it off because, they say they just didn't want to get bad news?
We hear that all the time, and honestly, that kind of brings me back to that my job as a navigator and that whole team approach. You will never, as you come into care, you're going to have an entire, team of people that are wishing to make, each day that you're going through your care or series of appointments and so on, whatever is happening, your screenings. We're here to make the day easier. That is exactly why we're here. So you're not alone. I guess this is really what I want to say at that point when you mention folks that might have put some things off for a while. Just continue to let us know how we can best help you. Get that conversation going with your healthcare provider, your primary care doctor, your nurse practitioner. Make those annual wellness exams. Ask about, your yearly mammogram. They can guide you with that. Just know you have a team of people that are there to help you. So I encourage you, to get to know us. Let us be part of your family, your healthcare family.
There are some warning signs for breast cancer sometimes, but some women may not notice any sort of problem and yet get diagnosed.
You may have no symptoms whatsoever. So it is truly the self-breast exam or the clinical breast exam or the mammogram that catches a change that is that crucial catch, that we catch early, and we can follow up on that. Conversely, on the other side of that prudent follow-up and those exams, screenings and those kinds of things might catch and identify a few changes, but also feel confident that just because you have a change, it doesn't mean you have cancer either. Those are just good things that we want to catch early so we can get a little bit more evaluation to be sure what we're working with and to keep you, to keep you healthy. Absolutely. Let the doctor figure out what's next. You don't have to worry about what it might be. Just get some help from an expert and some follow-ups.
That's Jackie Murray, and I'm Randy Bell. Medical Monday is presented by St. Dominic's.